Smoking cessation is an important part of COPD management. Are there additional management tools for patients with COPD?
Yes, I will review the management of stable COPD. Once COPD has been diagnosed, the effective management should be based on individualized assessment of current symptoms and future risks. To reduce the symptoms, we need to relieve the symptoms, improve exercise tolerance, and improve the health status. To reduce the risk, we need to prevent the disease progression, prevent and treat exacerbations, and reduce mortality. These goals should be reached with minimal side effects for treatment, and that is particularly challenging with COPD patients because they commonly have comorbidities that also need to be carefully identified and treated. I'm going to show you this chart right here. This is called non-pharmacological management of COPD. And Mrs. Tubbs is in the BCD group. She's in group B, but BCD is grouped together. For the essentials, it's recommended that she quit smoking with the smoking cessation, and that can include pharmacological treatment and pulmonary rehabilitation, recommended physical activity. And the local guidelines, she needs a flu vaccination and a pneumococcal vaccination. Now I'm going to show you this. This is the pharmacological treatment or pharmacological therapy for stable COPD. Once again, Mrs. Tubbs is in Group B. And the first recommendation for first choice medicine is a long-acting anticholinergic or a long-acting beta-2 agonist. Alternative is also a long-acting anticholinergic and long-acting beta-2 agonist. And for other possible treatments, it is recommended a short-acting beta-2 agonist and or a short-acting anticholinergic and theophylline. I know that sounds confusing because I'm just throwing out these types of medication to you, but I'm going to tell you what they are. Anticholinergic, what it does, it dilates the airways in the lungs, making it easier for the patient to breathe, and it may protect the airways from bronchospasms. And bronchospasms can happen suddenly, and all that is the airways get really narrow, and that can happen really fast. And they also can reduce the mucus production in the airways. A beta-2 agonist works by activating the beta-2 receptors in your lungs. And what that does is it causes the airway muscles to relax, so it makes it easier for the patient to breathe. And in the other possible treatment section, it talked about theophylline. What theophylline is a bronchodilator, and it works by relaxing the patient's muscles in the lungs and in the chest, making it easier for the patient to breathe as well. For the first choice long-acting anticholinergic, we would typically use Spiriva. The generic name is tiotropium, and it is given to the patient in 18 micrograms by dry powder inhaler every 24 hours. A long-acting beta-2 agonist would be Ceravent Discus. The generic name is Salmeterol, and that dose is between 25 to 50 micrograms, and that can be given by a meter-dosed inhaler or a dry powdered inhaler every 12 hours. For an alternative choice for a long-acting anticholinergic, we could give Tordorza Pressair. The generic name is alkylidium bromide, and that dose is 322 micrograms, and is given by dry powder inhaler every 12 hours. A long-acting beta-2 agonist for the alternative choice, we could give Perforomist is the brand name, and the generic name is Formoterol, and the dose for that is 4.5 to 12 micrograms every 12 hours. You can do that either a meter dose inhaler or a dry powder inhaler. For the short Acting beta-2 agonist, we would give Provenol. The generic name for that is albuterol, and we give that as 5 milligrams per milliliter in a small volume nebulizers every 4 to 6 hours. And for a short acting anticholinergic, we would give Atrovent. The generic name is ipratropium bromide, and we give that in a solution of 0.5 milligrams per milliliter in a small volume nebulizer every 6 to 8 hours. Lucy, I'm sure Mrs. Tubbs is available now. Do you have any more questions?
No, you've been very thorough. Thank you so much for helping me learn more about the role of a respiratory therapist in smoking cessation and COPD management. I'm looking forward to the rest of the day.
You're welcome.